The abortion lobby is really good at screaming bloody murder that pro-life pregnancy centers are fake clinics when they aren't even pretending to be clinics. But they don't get upset at all when a woman dies at what's legitimately a fake clinic. Today's November 16th, and this is Christina with the Sisyphean Journal. Now, one of the things we've noticed when I was at Life Dynamics is a lot of doctors doing abortions would call their private practice by a name that made it sound like it was a clinic. And there's a big difference between a clinic and a doctor's office because the clinic is subjected to inspections and different health and welfare requirements that a doctor's office isn't. So women going in to a facility that looks like an abortion clinic but is actually a doctor's private practice are not getting the legal protections that they believe they're getting. These are the real crime of fake clinics that the abortion lobby doesn't even want to think about, much less let you know about. Today we're going to talk about what happened to at Dr. Meeyoung Kim's clinic. What did she call it? Landmark Women's Center. Now, if you saw an ad for Landmark Women's Center, would you think that was a clinic or would you think that it was Dr. Kim's private practice? You'd think it was a clinic. It was a fake clinic. And Dr. Kim had a troubled past. She had already surrendered her New York license in 2000 when she was threatened with revocation for grotesquely mishandling an abortion patient in 1997. She had told the patient that she was only 8 weeks pregnant, but after she started the procedure, she noticed that there was an awful lot of amniotic fluid there. Kim instructed her patient to go to the hospital, and there, at the urging of a nurse, Kim asked for an ultrasound scan to determine the size of the baby's head, which indicated a gestational age of just past 26 weeks, which is way into viability. The baby's heart rate was slow, but the baby was still alive, and Kim tried to stimulate labor using drugs. Now, the baby unfortunately died, but the mother didn't go into labor, so Kim performed a C-section and delivered the dead baby. Documents don't indicate if, after Dr. Kim admitted this patient to the hospital, she told her that the baby was still alive and 26 weeks gestation and gave her an opportunity to try to save the baby or not. But this is the kind of doctor who opened Landmark Women's Center. Looks like a clinic, wasn't a clinic. The Virginia Medical Board didn't take any any actions on her license, but she was placed under stipulations regarding her use of anesthesia in her office and her record keeping. So while she was under close supervision, she did make improvements, and her license was fully restored in Virginia without stipulations on May 8th of 2000. So nobody was keeping an eye on her when a 26-year-old woman identified as patient A in the documents went to Landmark Women's Center, the fake clinic. Now, I don't like to just call women patient A. To me, that dehumanizes them, so I gave this young woman the pseudonym Adele. Kim didn't order proper lab studies, she didn't document an appropriate history, or perform a proper exam before beginning her abortion on November 16th of 2002. So Kim administered 25 milligrams of Versed to Adele in response to her reports of pain over a 10-minute period without giving the medicine time to take effect. Now, she told Kim that she didn't give Adele any analgesia for the pain because she gives enough Versed to cause amnesia so that the patient can't remember the pain. And I've said, if I had Aladdin's lamp and got 3 wishes, one of the things I'd wish for was that National Abortion Federation meeting and risks management seminar tapes were available on YouTube and could not be deleted, because you would get to listen to a discussion on whether it was ethical to not give analgesia and just give them enough Versed that they can't remember how much pain they were in. That seems pretty callous to me. And how can you listen to that woman in pain and go, she won't remember it? So the board noticed that Kim lacked judgment and knowledge of intravenous conscious sedation and was not fit to supervise a CRNA, certified registered nurse anesthetist. Now, at the end of the abortion, Kim noticed that Adele's pulse oximeter reading was only 70%, which is alarming. It should be close to 100%. And the pulse oximeter is one of those little things they clip on your finger, and it can track your pulse and how much oxygen is in your blood, hence pulse oximeter. Kim thought that she found a pulse, but she didn't assess whether or not Adele was actually breathing. She just ordered her staff to give Adele oxygen by mask and call 911. Now, Kim did administer a drug to reverse the effects of the Versed, but didn't notice that Adele had already gone into cardiac arrest, so she made no effort to resuscitate her. The ambulance crew arrived and transported Adele to the hospital, where she was declared dead from a possible air embolism. Now, the medical board noted that Kim was not certified in advanced cardiopulmonary life support. In other words, she did not have the CPR certification that she should have had merely as a doctor. And the staff at her clinic should have been certified in professional CPR. And neither she nor anybody else on staff was qualified to perform an intubation, which is when they put the tube in so that they can know that the air is going into your lungs and not into your stomach. And they didn't know how to use crash cart equipment. Kim did not document the operative report for Adele, and she told the medical board that the police had told her not to make any notes in the file. So here's this young woman dead. She went to what she thought was a clinic where everybody knows CPR, would all be on the up and up, and everybody be qualified, and all this safety stuff would be in place. A woman died at a fake clinic. But the abortion lobby is too busy wondering whether women are being annoyed by pro-lifers than they are about whether women are being killed by pro-choicers. Those are their priorities.